Welcome back to our listeners. We are taking you inside global health leadership with Dr. Shakira Choonara on women's health, the United Nations, and life in the United States. Shakira is a multi award winning public health practitioner, gold health officers, and 2017 Women of the Year in Health, South Africa. Very good morning to you, and Assalamu alaikum, Doctor.
Walaikum salam, Anisa, and it's wonderful to check in with you and the team.
So you've worked within the global institutions, including the United Nations, and from your vantage point, what can you tell us are the policy gaps that exists when it comes to women's health?
Nisa, it's been such an incredible journey, and I've been so privileged to have worked across several United Nations agencies, so from UNAIDS to the World Health Organization, and most recently, UN Women as well. And when I started off in this space, I could already start to see a decline in support and a regress on women's health. But as I worked specifically these last 2 or 3 years at UN Women, where I was based in New York at the headquarters as well, the policy gaps have become a lot more imminent. And I say this because, traditionally, you would have member states get together once a year, for example, what's called the Commission Status of Women, or even the celebration of the International Conference on Population and Development of 1994, which gave significant rights to women's health as well. And so previously, you'd see that a large number of member states, even 30 years ago in 1994, would support women's health, would support gender equality. But in recent years, the gaps are really that there's a rise of conservatism and really left wing across the world, including in powerful states. And what this means is that the world is not reaching consensus anymore on global declarations. So even if they are adopted, they're watered down. I remember sitting in many meetings for the past 2 or 3 years where certain member states would say, there's no such thing as gender equality. Take the wording out on women and girls, take the wording out on key and vulnerable populations. And all of this is really, really concerning. So, at that policy level, we used to be really comprehensive, really ambitious from 1994 to 1995 with the Beijing Declaration of Action. But sitting, 3 decades later, all of this language and the rights around women and women's health are now being contested.
No, that is quite scary, when you speak about there being no consensus on global declaration and how that actually affects everything else. Can you talk to us about your work with the other organizations? Because you have worked for the World Health Organization as well, UNAID, as well as UN Women that you've just mentioned. Can you speak to us about your experiences working with such global institutions?
Sure, and I'm so excited to have worked with these organizations. It's not something I ever planned. I always wanted to serve and serve South Africa and Africa specifically, but nonetheless, it was an honor to have been at the global stage. Each agency does very different work, and it was really, really exciting and an exciting part of my life and my journey. I would talk about UNAIDS first. At UNAIDS, a lot of work was obviously centered on people living with HIV, but specifically women and girls living with HIV. The highlights were really working with the first ladies or former first ladies in many African countries, like the former first lady of Rwanda, Botswana, and Namibia, to craft out their youth strategies. What was also so exciting to see, Anissa, was that these first ladies had no bureaucracy, no red tape. They sat down with young people at lunch tables and dinner tables and formulated their strategies. A lot of other exciting work at UNAIDS was conducting work around what's gender and HIV look like in countries like Tanzania, which I had the opportunity to travel throughout the country, but make recommendations to government for their next round of policies. So that's a little bit of the work that I did at UNAIDS. And the World Health Organization, for me as a public health person, was absolutely hugely exciting. I was working between women's health, of course, but also working on the health workforce. So the health workforce is really human resources for health, those who make up the healthcare system, doctors, nurses, pharmacists, as well as so many others. And really bringing out at the policy level what's the gender issues, what's the health systems issues. I was placed in very exciting positions where, as a researcher, I was able to look at the evidence, tailor the evidence, work together with member states to develop global policies as part of a team. And one of the most exciting highlights of my career, I would say, was I think it was 2023, 2022. Yes, it was 2022. Member states had adopted the 2022 to 2030 Working for Health Action Program on Human Resources for Health at the World Health Assembly. And that's being used by member states across the world. And I remember pinching myself and being very excited to have been part of a global policy adoption process. At UN Women, my work was more challenging. I worked within an increasing conservative environment, an increased Trump sort of environment, but nonetheless, it was also really exciting. I had the opportunity to manage and work together and lead and support almost 300 partners all across the world to deliver on their commitments to women's health and sexual and reproductive health and rights. And so, it entailed working a lot with governments, civil society organizations, youth organizations, the private sector. It got me particularly excited because it's such a huge or mammoth of a task to work with 300 partners. I remember coming in being quite young myself, around 33 at the time, and also leveling the power dynamics between partners, but also making sure that partners are able to work together. And 3 years later, it was really exciting to see through the work at UN Women that 300 partners had, one, started to deliver on their commitments, and two, were collaborating. And for me, that was highly, highly exciting. So just a little bit of a snippet of some of the 5 years of work.
Yeah, no, it's always amazing to hear people as busy as yourself speak about the work and achievements and the progress that they have made. And to wonder if we really all have the same 24 hours, and how you actually balance that. I wanted to check in with you when you mentioned working with the first ladies in some African countries. How receptive were they to your recommendations? Because you did say that there was almost no red tape in the bureaucratic systems. But when it comes to the recommendations that you make, how was that received and implemented thereof?
I would really talk about the first lady or the former first lady of Botswana, Neo Masisi. She was just so impressive. And so it wasn't really looking at my recommendations, but it was looking at the recommendations of young people. And I remember, the way the event organizers had set everything up. There was bureaucracy, but she had come at lunchtime and sat down with myself and many, many other young people in Botswana at different meetings. And she also, I noticed that she had a big stack of books she had been reading on meaningful youth engagement, youth employment. I was just blown away and impressed. So you could see that, the former first lady was so invested in young people, but she was willing to learn and listen as well. In terms of being receptive, we traveled throughout the country and we had various consultations. I personally felt that she, her office, and her team had really listened very carefully and had crafted the strategy based on youth recommendations. And they were also, one of the good things about being in Southern Africa specifically is that our politicians, our governments are more progressive. So there was no pushback on language on key and vulnerable populations. There was no pushback on language that young people wanted. That was really, really exciting to see.
Oh no, that is really amazing to hear. I want to hear about what it was like when Trump took over compared to the picture that you just painted for us. But I want us to unpack that after the break. We'll just be taking a quick ad break and we will be right back after this.
Across Sudan, starvation is tightening its grip. With rising food prices and widespread malnutrition, 8.7 million people are now facing emergency or famine-level hunger. As the conflict intensifies and aid routes narrow, families in Sudan are running out of options and time. The Al Imdad Foundation is delivering life-saving humanitarian aid to those most at risk. Stand with Sudan. Donate online at alimdad.com or call 0861 786 243 for more information.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
With Ashraful Aid this Ramadan, your zakat changes lives. It feeds families facing hunger, restores dignity to those in need, and brings hope where it is needed most. From food relief to essential support, your zakah reaches communities with care, transparency, and impact. Give with confidence, give with trust. Make your zakah count this Ramadan. Give your zakah to Ashraful Aid and help change lives today.
The Prophet Muhammad, peace be upon him, said, "Use the black seed, for indeed it is a cure for every disease except death." This Ramadan, honor that guidance. Tip Black Seed supports your blood sugar during fasting, boosts immunity, sustains your energy from suhoor to iftar. Available at leading pharmacies. Tip Black Seed, your golden drop every day.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
This Ramadan, please consider donating to the Islamic Dawah movement. For over 45 years, IDM has built over 80 masjids and distributed more than 160,000 Qurans in 8 local languages. IDM has installed over 250 boreholes and water wells. Over 1,000 children are fed daily, building strong Muslim communities in disadvantaged areas.
You are listening to Salam Media live from our headquarters in South Africa. This is Salam Media, keeping you company this Ramadan.
Welcome back to everyone that has been tuned in. We are still with Dr. Shakira Choonara, who is taking us inside global health leadership. And, you know, when we speak about young people providing a blueprint in leadership in all spheres, you know, this is an example of someone who has done exactly that on global stages. And we appreciate the work and the contribution and the restless nights that you've had for, you know, laying this foundation, laying the blueprint. But that does not come without its stumbling blocks. I'm interested to find out from you what it was like as someone who was based in the United States, what it was like when Donald Trump took over.
You know, Nisa, I'd like to write a book about it someday, but I think also we're living this nightmare, if I can call it that. We're living this nightmare live in a sense. You know, I believe in his first administration, he showed us what he would do to women's health specifically. He had what he called, or his administration had what they called and passed a global gag rule. And under the global gag rule, they had defunded all institutions who did any form of abortion work. But what this meant is that even if you were not using US funding, say you were using Swedish funding to do abortion work on the continent or across the world, they would defund you. In the first administration, the global gag rule meant that even institutions who work on HIV, institutions who work on water, sanitation, and hygiene, and so many others were already defunded. 2026, fast forward, this year he and his administration have expanded the global gag rule not only to focus on abortion, but also institutions who focus on diversity, equity, and inclusion will also be defunded. So looking back really to last year and the build-up just before that, I remember, when I first joined UN Women, many of the partners I had worked with, whether they were in advocacy or government, had told me about how the conservatives would infiltrate our meetings. And so I had some idea, but I had never experienced it. When I actually got to New York in March 2024, I was facilitating a meeting within the United Nations headquarters, sitting with ministers from Nepal and other countries as well. And I remember one of the ministers' security had passed me a note to say, please be careful. The people behind you are the opposition. I had never felt, I'm not usually afraid, but I never felt so uncomfortable in a sense, and so it was even before he came into administration that you can see the conservatives and the Republicans are starting to infiltrate meetings on gender equality or anything they don't believe in. And they're infiltrating the United Nations as well. And post that, I was sort of targeted as having worked in the space on women's health as well. I didn't worry too much about it, but what I had noticed, at least in 2024 in the US, is, and specifically in UN meetings as well, is for our safety, we had to have closed meetings. We had to vet who would come into meetings. And I feel that that really limited the space. I mean, we come from South Africa, which is the land of the free. We say what we want, we do what we want, and it's a wonderful place to live. And so, a country that preaches democracy across the world, you're now sitting in a space where you need to have closed meetings. You need to be careful. You need to worry about the safety of people. So this was all in the build-up really to the administration. And there was a point where the administration had even looked into my project and portfolio of work. But I wasn't afraid, because what's also interesting in the global landscape, and it's good for us to know, is that it's not only the US that's powerful. We have other member states who stand up against them. And so, especially on the front of women's health, for example, we have the support of governments, especially those such as France, Denmark, Norway, so a lot of the Scandinavian countries, a lot of Europe, South Africa, specifically Jamaica. So, what I would also see playing out in this space is that, yes, the Republicans, conservatives, and other states were trying to push against women's health and infiltrate our meetings, but we also had powerful member states sort of, pushing against it as well. Come to 2025, and like I said, I can write a book, but I'll just give a brief overview of really what a dire situation it was. I mean, a lot of us working in this space on women's health and key and vulnerable populations' health, we expected that there would be cuts to funding like the global gag rule. What we hadn't expected was massive defunding of the World Health Organization. Right now, the World Health Organization is facing a $2 billion shortfall. So there's been layoffs in Geneva, lots of retrenchments across UN agencies as well. The UN has been defunded. At that time, it felt very surreal to me. I think it was around January, February last year. Walking around the United Nations headquarters, you could feel a dampening of spirits. Things were a lot quieter. The UN had to cut budgets massively. So, for example, meetings which would be held way into the evening would now only be held into the day. The UN headquarters, once a buzz of activity, had now become Sure, there's some activity, but a level of it, because also people were struggling to get visas to come into the country. And you'd also see your fellow staff members being laid off. And so what we'd find is within institutions, lots of insecurity. But also, walking around HQ, you would see the security and the staff and so many wonderful people who made up the headquarters. Even their jobs were at risk of being lost. So there's been significant defunding of the UN under the Trump administration. Under the Trump administration, it's either that you sort of, and if I may say, and I'm not very politically correct because I'm not in the UN anymore, which is fine, but you either puppet where you follow the money, or you sort of stand up to the Trump administration. And that's also been the two different ways that you've seen things go. Either way, again, his administration is specifically against the term gender equality, the terms diversity, equity, and inclusion. His administration is against women's health. And so all of this is it's really huge, even against migrant health, for example. And besides defunding these large-scale UN agencies, he's also defunded, as you know, country governments. So a lot of our programs were also affected, where HIV clinics had to close, HIV staff had to be laid off as well. The impacts were immediate, and recovery is still a long way away. Finally, there's also been an impact on feminist organizations, civil society organizations, so a declining of civic space. So many youth organizations, women-led organizations have shut their doors immediately. So, I think sometimes we think, sure, there's the war in Iran, et cetera, but I think also that the Trump administration has had such a significant impact that's sort of reverberating across global health, which is really, really, concerning and alarming at this point.
Yeah, no, that sounds like so much of mayhem, just from I wouldn't say one individual, but a collective. And I think you should really write that book. I will definitely purchase and read that book. If I'm just thinking about the term that you used, global gag rule. How do you even define that? How do you even coin that? How do you even phrase that? And I wouldn't have believed you if I wasn't, if we didn't even hear about how he renamed the Department of Defense to Department of War, for example. But just as we close, I'd like for you to take us through your personal journey, as someone from South Africa finding themselves on the global stage, making these contributions within these institutions. I mean, it's amazing the amount of work that you've done. How has that been for you, and what advice would you have to younger people, but to the people in general?
Anissa, it's been a humbling experience, and I'm still humbled up until today. Sometimes I pinch myself and say, is it really me? I remember, being one of the young people who used to fight against the UN a lot, because, I used to be flown to the UN for 5 minutes to enter the building and not have access to anything else. And so becoming a staff member was a huge amount of privilege, which I appreciated. And I remember that, when young people would visit New York from Africa, I would take them into the UN, because it's so important that, we also open doors for others. My journey is one of gratitude for a lot of different things that shaped me, but I also came from a disadvantaged background. And so, I was pretty studious. I put my head down. I wanted to sort of escape everything that was happening at the time and make a better life for myself and my family. And so, that of course happened. But I think that also what I sort of keep true as a mantra early in my career and up until now as well, is that you're an activist. And whatever space you're in, sometimes you don't have big global change that you bring about, but there's small scale things that one does. So for example, even at UN Women, I would take time to sit down with the interns and give them meaningful work. And they were so excited to be able to do that. So The mantra is really, and the way I guess I sort of propelled on the global stage, is I never lost my authenticity, but also I always kept my activism out there. One of my very first UN meetings, the UNAs had given me to moderate or facilitate. They had given me a script, and I remember trying to go through the script, but it was never going to work. So I threw the script away and moderated as I wanted to. And that opened many doors for me. And so throughout the career, it's also been important to be able to build partnerships with governments, with civil society, to listen, to be, as I said, to be humble, and to try and see how we work together instead of being fragmented. A lot of different agencies, people try and go alone. I think trying to go together gets us a lot further. So again, it's been a hugely humbling, privileged and exciting experience for me as a young South African woman of color to have been on the global stage.
Yeah, no, amazing work, and most definitely your work speaks for itself. And you being an inspiration to many people out there. And like I've been saying, your work, your blueprint, your dedication, and everything. We are truly grateful for that. That was Dr. Shakira Choonara, who was speaking to us about women's health, the United Nations, and life inside the United States. From Trump's mayhem to working with former first ladies to global health. Shukran so much for joining us, Dr. Shakira. I think we'll just be taking an ad break and we should be right back after this.